Okay, everyone, we can go ahead and get started today. Hello, everyone. Welcome to the webinar. Before we get started, we'd like to go over some logistics for today's event. We are pleased to provide live closed captioning for this webinar. The webinar will be in English, but if you would like to see captions in another language, please do the following steps. To turn on live captions, go to the meeting controls panel at the top of your screen and select More, represented by the three dots, then choose Language and Speech, and then proceed to choose the option to turn on live captions. The captions will appear at the bottom of your screen below the webinar slides. To change the language your captions appear in, select the Settings button near the captions, then select the Caption Language option, and choose the language you'd like to see the captions translated into. Please also note that this webinar is recorded and the recording will be shared on the NPI EXPAND website after today's event. Finally, we encourage all participants to submit questions throughout the webinar into the question and answer box at the top of your screen. Our team will be collecting these questions for a Q&A portion of the webinar. Now, I'm really happy to turn it over to Jeff Barnes, our project director, to kick things off.
Good morning, good afternoon, good evening, depending on where you are. Welcome to today's webinar. I am very proud to kick off today what is our 8th and final webinar in our Lessons in Localization series, focusing on different issues related to localization. Slide. For those of you who don't know NPI EXPAND, we are a global project that was funded by the New Partner Initiative in 2019 and implemented by Palladium. We are or have been working in 11 different countries around the world. We have provided financial and technical support to 92 local partners around the world. This is the final webinar in the series, as I mentioned. All of these webinars have been recorded and they are on our website. We've tried to cover a range of issues related to localization, from funding, resource mobilization, indirect costs, gender, and finally, what in some ways is considered, to me at least, one of our most challenging areas, which is local capacity strengthening. We're trying to share a little bit of what we've learned and some perspectives of our local partners. I think it's fair to say capacity strengthening was probably our biggest challenge, and I don't think that's a surprise to anyone who works in this space. We explored these issues through a learning question paper, and one of our lead authors, Sarah Pennington, will be sharing a summary of what we learned through the paper, and then we'll explore the issues further through a discussion with an esteemed panel who we will introduce shortly. And now I'd like to turn things over to Erin McGinn, who is the other author on our paper, and who has kindly agreed to be our moderator for today. Over to you, Erin.
Thanks so much, Jeff. Welcome, everyone joining us online. My name is Erin McGinn, and I'm a technical director in the health practice here at Palladium. For today's webinar, as Jeff mentioned, we want to share some of NPI EXPAND's experiences with local capacity strengthening, showcase a few thoughts from our country-based partners via video clips, and discuss some of the issues with two subject matter experts. Local capacity strengthening was at the heart of the NPI EXPAND project, if for no other reason than the fact that it is local organizations that are at the forefront of implementing programs within their communities to improve the quality and availability of health services, products, and information. Tangible and long-term development hinges on local entities having the technical and organizational capacity to be both impactful and sustainable. While global health projects have always partnered with local organizations and in many cases invested in capacity strengthening along the way, the global health community is doing a more systematic job of encapsulating collective learning and best practices in capacity strengthening. And the NPI EXPAND project has significantly contributed to that over our 5 years. We will start out our discussion today with a presentation from my colleague, Sarah Pennington. Ms. Pennington is a Senior Technical Advisor in Monitoring, Evaluation, and Learning at Palladium, and she worked with the NPI EXPAND team to conduct key informant interviews with select local partners on their experiences with capacity strengthening, and to explore the links between capacity strengthening and improved organizational performance. During Sarah's presentation, I invite those online to put questions in the question box, and we will have a Q&A session at the end of the panel discussion. Over to you, Sarah.
Thank you so much, Erin and Jeff, for that introduction and for setting the stage for us. I'm pleased to share some of the highlights from the qualitative research we conducted to try to understand the linkages between capacity strengthening and organizational performance improvement. Next slide. So as USAID's local capacity strengthening policy from 2022 emphasizes, capacity efforts should be locally driven in order to be effective and sustainable. Capacity strengthening is quite a complex and time-intensive process, and measuring it can be challenging. The policy defines capacity as a form of potential and suggests that in order to know if capacity has been improved, we have to see it being used or applied. And this is done through improved performance results. Since every organization is going to have unique and specific performance objectives, we use the indicator CBLD9 to measure how many organizations are demonstrating improved performance in the areas they prioritize for themselves. Through this project, we sought to better understand the link between capacity strengthening inputs and performance improvement results. Thus, the learning question, next slide, that this paper aimed to address was, how does capacity strengthening contribute to improved organizational performance? We wanted to examine whether the technical assistance provided had in fact contributed to strengthened capacity and whether our partners had observed performance improvement. If they had, we wanted to understand what the success factors were, and if not, what were the key challenges? If they had achieved performance improvement, how would they go about sustaining it? What would they want to see done differently by capacity strengthening TA providers, with the understanding that many of our local partners receive technical and organizational capacity strengthening support from a variety of international providers and probably have a lot of experience with what works and what doesn't. So before I share the perspectives of the partners and some subject matter experts we interviewed on the impact of capacity strengthening support, allow me to provide an overview of what capacity strengthening looked like within the NPI EXPAND project. A key focus for NPI EXPAND was capacity strengthening of organizations operating in health service delivery. NPI EXPAND issued subawards to local organizations to support both their organizational and technical capacity development, with the ultimate goal of increasing the availability and use of quality health services. NPI paired project implementation with targeted capacity strengthening support to purposefully cultivate and diversify USAID's local partner base. NPI facilitated organizational and technical capacity assessments as action planning tools with over 30 organizations and co-developed capacity strengthening plans with each, based on each local partner's own priorities. We provided technical support through a variety of mechanisms to each organization to implement their CS plans, including collaboratively designing and facilitating upgrades or adaptation of organizational processes, mentoring and coaching, virtual and in-person trainings, hands-on demonstrations, or collaborative work, supporting development of plans, reviewing and providing feedback on documents, and sharing information resources, among others. The organizations largely prioritized organizational capacity strengthening rather than technical areas, choosing to work on improving their administrative, IT, grants management, financial management, and strategic planning systems. Many focused on resource mobilization, while some also looked at board development, human resources strengthening, knowledge management, communication skills, and M&E and data quality and use for decision-making. A few did request support in strengthening the technical delivery of their programs, for example, in family planning or social accountability programming. A subset of the organizations further identified performance indicators they would track over time to respond to USAID's CBLD9 indicator. And they used internal management indicators, things like financial performance indicators, organizational strengthening output indicators, for example, the number of policies developed or implemented, and project performance indicators, for example, the number of people reached with health messages or provision of contraceptives. The project also supported these partners in monitoring their performance against their selected organizational performance improvement metrics so that we would be able to report to CBLD9. So that summarizes the capacity strengthening support provided by NPI EXPAND to local partners. And now I will talk about our qualitative assessment to attempt to answer our learning question. So we conducted 2 sets of key informant interviews. We asked 4 subject matter experts who have long backgrounds in providing capacity strengthening technical assistance for their big picture thoughts on the field, key approaches and considerations, and the direction they see this area going in as global thinking evolves and priorities shift toward more localization and local ownership. We also interviewed representatives from 7 of the organizations that NPI EXPAND provided with capacity strengthening support and that had selected performance improvement indicators to track. We selected for a subset of organizations that were still actively implementing a subaward in the final year of the project. And we also set criteria to give us a varied sample of respondents who had received different types of support that represented different geographies, technical areas of focus, and organizational maturity levels. We asked a standard set of questions and analyzed the responses to identify recurrent themes and lessons learned. And to supplement that qualitative component, NPI also reviewed the self-reported performance improvement of all grantees that were tracking individual indicators against CBLD9, not just the grantees we interviewed for the paper. So what did we learn? Starting with our subject matter experts, they had some high-level thoughts on what works and what to avoid in providing capacity strengthening support that contributes to sustained organizational performance improvement. Successful CS approaches are demand-driven, have the buy-in of the institution's leadership and staff. It's clear to all involved how the capacity strengthening work aligns with the organization's own long-term goals and activities. Successful capacity strengthening interventions address the needs and priorities of the organization and its local system, are organic and flexible, and sufficiently resourced. They apply adult learning principles and are sustained over time through routine mentorship and coaching. This builds trust between the organization and the TA provider. Ideally, the support also connects local organizations to one another to share learning and support each other, and strengthens a local TA marketplace over time so that international donors and TA providers can eventually step back. On the flip side of that, what doesn't work? What the subject matter experts described having seen fail included things like overly focusing on trainings or providing one-off trainings that don't ensure there's sufficient staff capacity to institutionalize the knowledge or skills, or not following up with ongoing coaching or mentoring support. Similarly, being too rigid around trainings or tools and not tailoring them for the needs of the local organization was a what not to do. In the same vein, while it is important to help local partners prepare to receive direct funding, we shouldn't be focusing on getting them to comply with donor requirements or setting up monitoring or reporting systems just for the sake of making donors happy at the expense of the organization's own priorities. One expert we interviewed told us a story about an organization that set up a timekeeping system just to be able to report to the donor that they had one, and they didn't actually use it for their own management system at all. Our experts also talked about founder effect, having seen organizations that didn't account for succession planning fail when a charismatic leader left. And they mentioned that doing an organizational capacity assessment is not a capacity strengthening intervention. It should be an action planning tool. The issue of giving enough time for capacity strengthening interventions to move the needle on programmatic performance came up more than once, as did not ensuring that interventions were truly demand-driven. These are things that do not work to sustain strength and capacity or improved organizational performance. The local partners we interviewed all described their capacity strengthening efforts as successful. Can you go to the next slide, please? They talked about the capacity strengthening areas they prioritized in the assessment phase versus what they observed as having improved, which you can see in the graph on the right. Overall, the partners reported that they felt their organizations were more structured and stronger, better positioned, exploring new funding opportunities, and had improved networking skills within their local system due to the capacity strengthening investments. They highlighted the collaborative approach and hand-in-hand nature of NPI EXPAND support as key factors for their success. We have a few video clips from partners who also shared what they found the most valuable of the capacity strengthening support. Robin?
NPI EXPAND, we received a range of trainings. All the trainings were of great value, but particularly the one I would like to mention, which impacted our organization, was the resource mobilizations training, which we received in Islamabad from NPI EXPAND. Particularly, I would mention this training because it changed our whole strategy and it affected our organization a lot in a positive manner. We have been struggling with the financial sustainability of the organizations, and this training, in fact, helped us in recognizing and identifying the issue that was that we had not following proper strategy and were not following the resources mobilization in an organized manner. So after receiving the time, what we did that we developed our own resource mobilization strategy. We strengthened the resource mobilization unit, and instead of responsive approach, we made our approach more proactive, and now we are feeling more secure and we are hopeful that we will receive more and more funds, and we will have diverse sources. We are having now diverse sources for resources and financial sustainability. Thank you.
Therefore, is a local NGO based in Tanzania since 1994. On behalf of Shidefa Plus management team, I really want to take this opportunity and appreciate the USAID Palladium and AMREF Tanzania for awarding us the NPI EXPAND project, which is called the Twinwana Tuyajenge project. Because through this project, we have been able to strengthen our organizational systems, both digital systems or e-systems, but also the strategies. Through this project, we have been able to install the well comprehensive ERP vision system for finance activities, which is integrated with procurement, store management, and human resource. And besides that, in terms of operations, through this program, we have been able to install the DHS2 MNE mail mist for information, specifically on data management. So now we can enter data. From data, we can analyze, we can put dashboards, but also we can use the data for decision making. So thanks to the NPI EXPAND. Also, we had an issue of reviewing and updating the guidelines of which we have at Shidefa, like the strategic plan, which is a roadmap to show us where we can reach our goal, our mission and vision, but also the advocacy policy, the communication strategy, and the partnership and networking policies. All of these policies are really useful guidelines and strategies which will put us to achieve where we want to achieve. And so we acknowledge this support because through these all things which have been installed and through updation of the document will now comply with the donor requirement, but will move from being the new underutilized partners to being the prime recipient. That's sustainability for the organization operations in Tanzania. Thank you.
The most valuable capacity strengthening intervention that we had from HDI EXPAND in the project that we were given was the Humanton online trainings. We really loved those trainings because they had flexible hours because of being online, and as our staff was very busy in conducting activities of this project, they had little time. If they would have little time if they were not online trainings, as they could attend these trainings in their off times in the evening hours or during weekends. And I thank the HDI EXPAND team for organizing it for Aman, because it has really strengthened our management and financial teams. Thank you.
Thank you to our local partners for submitting those video clips. So while the organizations that we interviewed reported that they had improved their capacities, and we've just heard some examples of those, measuring improved organizational performance against the tailored individual indicators they had selected. Oh, you couldn't see the clips. Is that true for everyone? Just got a chat that the clips did not show. we need to repeat them? Okay, I see a thumbs up. So I'm going to take that as it's okay and keep going. Okay. Measuring improved organizational performance against those tailored individual indicators they'd selected was more challenging. The health indicators reported by the local organizations we interviewed over the duration of their subawards were not sufficient to support conclusions regarding the impact of capacity strengthening on programmatic performance for several reasons. The highly contextual nature of the data, difficulty in mounting rigorous studies to determine attribution, and unavailability of documentation on organizational performance prior to NPI EXPAND collaboration all created roadblocks in determining whether program performance was affected by the capacity strengthening interventions. I'll give you an example on the next slide. One organization tracked 3 indicators. The next one. Linked to their performance goals. They aim to increase the number of clients served through the sale of a wash product, couple years of protection through provision of contraceptive methods, and the number of individuals reached by health messaging. So the wash indicator showed an astronomical increase in FY22 Q4, but this was because a commodity was about to expire and so was given away for free. Then for half of FY 2023, no units were provided due to stockouts of that product. However, if we were to omit that one quarter where they gave away the product as an anomaly and instead look at annual provision, it does appear that the performance improved over time. The CYP couple years of protection indicator doesn't suggest an increase in clients over time. FY22 data were higher than 2021 and 2023 was higher than 2021, but lower than 2022. And finally, the number of people reached with health messages increased each quarter of 2023, but then dropped dramatically in Q1 of FY 2024. And there's no pre-intervention data to hint at the organization's previous performance in any of these indicators. And NPI started working with this organization in FY 2021. This example and others are discussed at greater length in the paper, which I encourage folks to read. And I bring this out here just to illustrate some of the key challenges in measuring performance improvement and in linking it to capacity strengthening interventions. Next. So as I mentioned, among the challenges are that timelines are often used to monitor programmatic performance after capacity strengthening investments are usually short, just a year or two, and we know that capacity strengthening and performance improvement are complex and take time. External factors can also heavily influence a local organization's delivery of health interventions, for example, weather events, disease outbreaks, and political instability. And the terms of the subaward itself can also influence programmatic delivery. If the subaward funds both capacity strengthening and project implementation, it's likely that the organization will have better results reported against program metrics because those funds are supporting additional activities. Further, when organizations have support to monitor the results, their reporting tends to improve. But does that necessarily mean they're doing better or just documenting it better? However, I would like to note that across the NPI EXPAND project, of the organizations tracking performance indicators responding to CBLD9, 80% did report improved performance. So we don't necessarily have the linkage between capacity and performance, but we saw improvements in both, so we can draw our conclusions thusly. Next slide. When NPI EXPAND asked our local partners what they need to sustain the organizational improvements they achieved and what areas they thought they could benefit from more capacity strengthening support, resource mobilization was of primary concern. They cited things like proposal writing and sustainability planning and emphasized the need to diversify their funding sources. They also talked about institutionalizing the skills and processes within their organizations and training new staff to ensure knowledge isn't lost when staff leave. Finally, a common request was for further support in strengthening M&E systems to improve reporting, including reporting to donors. Some of the partners said that if their own reporting or data systems were strong enough, they'd be able to respond to different donor demands rather than creating new parallel processes or platforms for each different donor that they hope to attract funds from. So with that, I will pass it over to Erin to introduce the panelists for today's session. Over to you, Erin. Thank you.
Thank you, Sarah Pennington. I'm excited to turn to the discussion portion of our webinar. We have two panelists today for a roundtable discussion on their experiences with capacity strengthening. I have some questions to help facilitate a conversation, and then we will move to questions from the audience. At this time, I'd like to ask the panelists to turn on their cameras. We are excited to have them on board and look forward to hearing their perspectives. I'm honored to introduce Jasper Ondieki and Sarah Ellison. Mr. Jasper Ondieki is an international development professional with over 20 years of experience in organizational capacity strengthening. Mr. Ondieki currently serves as a Deputy Chief of Party for Bora Mashinani, a USAID Kenya funded program implemented by the Kenya Community Development Foundation, KCDF, to advance locally led development in Kenya. From October 2019 to June 2024, Mr. Ondieki worked as the Capacity Development Director for NPI EXPAND, where he played a significant role in designing and implementing the program's capacity strengthening strategies. Ms. Sarah Ellison is a Senior Policy Advisor at USAID on the New Partnership Initiative team. Ms. Ellison is helping USAID have more diverse and equitable local partnerships, specifically through the implementation of the local capacity strengthening policy. Prior to her time at USAID, she worked in the private sector, at international NGOs, at a foundation, and as university faculty, all focusing on organizational development, adult learning, and coaching and mentoring. Sarah's development career began in the Peace Corps in Benin. Thank you both for being with us today. I'd like to start first with a question for our USAID panelist, Sarah Ellison. Next slide. So with the increased focus on local capacity strengthening in many USAID activities, what are some of the capacity strengthening practices that have shown the most sustainable impact on performance?
Thanks so much, Erin, for this question. It's a pleasure to be with all of you here today, and thanks for inviting me, and thanks for that opening remark, that opening presentation, Sarah. And I really hope everyone gets a chance to check out the report. I got an early preview back in the day, and it was such a pleasure reading through it and seeing all those great lessons learned. So by way of further introduction, as Erin said, I'm on the New Partnerships Initiative team at USAID, but I'm an employee of Salience LLC and then embedded within USAID. And for the recording, no procurement sensitive information is being shared today. So back to your question, Erin, the evidence from adult learning and organizational psychology and development literature has been clear for some time and was even just highlighted in Sarah's presentation that training alone rarely produces sustained performance improvements. And that's why in the local capacity strengthening policy, USAID has principle 3 to strengthen diverse capacities through diverse approaches. I'd also add the importance of having the content, delivery method, goals of capacity strengthening investments all be demand driven by local actors. This is linked to principle 4 in the policy, aligning capacity strengthening with local priorities. The importance of linking to local priorities couldn't be clearer than in an example I want to give right now. A few years ago in Cambodia, the USAID mission there did a randomized control trial of a capacity strengthening activity called Resiliency Cambodia. The impact assessment was conducted by Cloudburst Group, a US small business. I've given the link to the organizers to share in the chat if you want to, or the Q&A if you want to check it out. Ultimately, the impact assessment said that the capacity strengthening the activity didn't really do anything. What I noticed from the description of the activity, and I hope you'll notice too, is that the focus of their interventions weren't very demand driven. The primary implementing partner determined what should be the focus, and it didn't really do very much. But now USAID Cambodia is designing with this knowledge in mind, with the knowledge that local actors must drive the decisions if you want to see performance change. And I salute USAID Cambodia, the other missions and activities like NPI EXPAND that are helping to add to this knowledge base. So we've talked about what doesn't work, but what does work. And as Sarah was mentioning, the data is really clear and continues to emerge that on-the-job learning, mentoring and coaching, providing full cost recovery, twinning, peer learning, and resources themselves, like money for local organizations to use as they see fit, layered on one another, has a bigger impact, potentially even layered with training. I do hope we'll continue to grow this knowledge base though, so look to all of you to contribute to that. Ultimately, there won't be one secret combination of capacity strengthening activities that will lead to results in every context and every organization. We do know, however, that we can't rely just on training and that those whose performance is going to be enhanced need to be in the driver's seat when it comes to decisions about capacity strengthening interventions.
Thanks, Sarah. Jasper, perhaps you'd like to give a comment as well?
Yeah, thanks, Erin, and I'm happy to be back, share my experiences with the rest of the team at NPI EXPAND and the other partners. For me, at least from my experience, particularly from NPI EXPAND, what I'd say is that the policy guideline, the local capacity strengthening policy that USAID issued, has actually shaped a lot of discussions out here as far as capacity strengthening is concerned. The combination of those principles, the principle of mutuality, use of a combination of different capacity strengthening approaches, have challenged us as development practitioners to think more broadly, more widely, in an integrated manner on how we advance our capacity strengthening. Right from the type of tools we are using, with the requirement that we report on the CPLD9, we ask ourselves, do those programs that focus purely on strengthening organizational capacities without going beyond to focus on service delivery, are they enough? Is there a way you can stimulate people to think on linking capacity performance by integrating, development efforts that are capacity strengthening focused with service delivery efforts? That's one point. The second one is, and looking back, having worked through these years, whenever you talk about capacity strengthening, people always think training. But the local capacity strengthening policy has challenged us to think beyond training, so that we are combining several different approaches to capacity strengthening, not just training, to be able to deliver our capacity strengthening results. And it's not combining these trainings in isolation or combining these approaches in isolation, but in the way in which they're integrated with each other. For instance, participants from an organization attend a training, helping them toward the end of that training to prepare, knowledge and skills transfer plans, then supporting them in their respective workplaces through a mentorship and coaching approach to apply those skills. Supporting an organization as you had, for instance, from Rabia in Shideva in Tanzania, to install a new software, that's addressing a challenge that they have in the organization, make it more efficient. Ensuring that staff understand this software, they're able to interact with it, they can be able to identify what gaps and what improvement they make over time. So is that integrated manner in which now we focus on our capacity strengthening, that indeed, even if, as you heard from our study, we do not have very concrete evidence to be able to link capacity to performance, but I'm convinced that over time, those are the type of approaches that are going to deliver for us capacity strengthening results. Thank you.
Thanks, Jasper. So for capacity strengthening providers with limited resources, do either of you have suggestions about where or how to invest? And Sarah, I'll give you first crack at that.
Yeah, absolutely. And I think I'm trying to look through the where to make those investments first and foremost is really in the demand-driven aspects of this. Those investments need to be tailored to whatever those organizations are looking for the most, and what links to performance, like Jasper was just talking about. So when Jasper was talking about, like there's a full range of opportunities and examples and potential roads to lead down to a full diversity of those potential capacities, and organizations are under pressure to deliver technical results as well. So really linking those efforts and any kind of investments to what is going to produce performance results for them, and their performance results per the local capacity strengthening policy. I think that's where those investments first need to be made, as well as things that are producing those longer term results like Jasper was talking about. So those early investments that you might not see in 2 years or 5 years time, maybe in 10 years time. So linking to performance results now, but also thinking about that longer system, that longer network, the relationships, the trust building that we can be investing in. I think those are areas where with limited resources, we should think about that trust building and performance.
Thanks. Jasper, do you have anything to add?
Yeah, I think for me, the type of assessments we complete to help organizations to identify and prioritize capacity needs are very comprehensive. And what I've seen from my past experiences on various organizations is no program I've worked in or interacted with that is able to address all the capacity needs that an organization identifies from an assessment. So the need to prioritize is very important. And I think coming up with a simple criteria that enables an organization to prioritize on what to focus on is important. Some of the things I encourage, and I've seen some of the organizations use is, for instance, how much money, how much resources available for this, how much time do we have? From the perspective of the funder for this initiative, there are also specific interests on what this funder is focusing on. So a negotiation with the funder on what to focus on, to balance between the needs and interests of the funding agents and the priorities of the organization. So that discussion, be able to prioritize based on specific criteria, I think it's very important, and it will be informed by a number of factors. Context matters as well as Sarah has mentioned.
Thank you. Great. All right, next slide, next question. An interesting finding from our key informant interviews was that at the onset, capacity strengthening priorities were identified by the local organizations were focused more on organizational development. Let's hear why from two of our local partners as to what their priorities were.
Je m'appelle Dr Cher Sarr, je suis le directeur exécutif de ADEMAS, Agence pour le développement du marketing social. En fait, pourquoi les organisations locales donnent la priorité au renforcement de capacités institutionnelles, organisationnelles? Parce que c'est des organisations qui sont très précaires et qui n'ont pas toute une capacité de bonne gouvernance, mais également toute une capacité de gestion administrative, financière. C'est la raison pour laquelle les gens mettent l'accent sur le développement institutionnel, puisque quand il s'agit de développement technique, peut-être là, ils peuvent faire appel à d'autres personnes ressources.
Why organizations give priority to organizational improvement is that once their systems have been strengthened, it will be possible to have a smooth running, even if a staff exceeds, as opposed to technical capacity strengthening, where without a proper exit plan, the expertise is lost once the staff leaves. Organizational improvement serves as a sustainability plan.
Thank you to our local partners for those comments. While this might be true, we also found that as NPI partnered with the local organizations over time, there was also demand for capacity strengthening in technical or program areas. So, Jasper, let me turn to you to ask. Can you talk about the diversity of capacities that local actors and organizations have been requesting support on? And have you noticed any shifts, even anecdotally, since the launch of the LCS policy?
Yeah, the the capacity needs from partners is diverse. Of course, my observation, even as you found from the studies, organizations are more skewed towards identifying organizational capacity needs as opposed to technical capacity needs. And I attribute that to those two factors. First, of course, is the type of tools we use for assessments. Depending on what tools you're using, what the tool is emphasizing more on, will influence what the organizations think or prioritize to be, what their needs could be. And it's for that reason I think it's very critical to use a combination of tools, focusing on several different aspects at the beginning of setting an agenda for capacity strengthening when you're completing the assessments. So in EXPAND, we used a combination of organizational capacity assessment and technical capacity assessment tools to be able to achieve this. But also from the organization who participates, the participants in the capacity strengthening efforts also determine on what, of course, based on people's biases, on what things they prioritize. So one of the things we did, and I encourage people to do, is involve as many people from the organization as possible, in that discussion about the capacity strengthening priorities, and ensure there's consensus on what is priority to focus on over time. Having said that, one thing we noted in NPI EXPAND is that regardless of the fact that the capacity needs for various organizations were diverse, there are some that were cross-cutting. For instance, you've even heard from the various case studies or various representatives of NPI EXPAND partners from the various countries. Resource mobilization came up as one of the cross-cutting needs. And maybe because of the emphasis on reporting on CBLD9 and demonstrating achievement of results, M&E systems were also emphasized quite a bit by organizations. There's, of course, the need, and this related to aligning to USAID, compliance requirements, need to strengthen internal systems. There's also the need to, focus on staff capacity strengthening as an incentive, to keep staff in the organization longer. So those are some of the observations I made as we were implementing the NPI EXPAND capacity strengthening agenda.
Thanks, Jasper. Sarah, are there any additional capacity strengthening requests you're seeing from the USAID perspective to add to what Jasper mentioned?
Yeah, thanks so much, Erin, and thanks, Jasper, for this. What I like about this question in general is that it recognizes that there's not a one-size-fits-all approach to what makes a successful organization. So when I think about a really successful organization, I think about one that's accountable to their stakeholders, not to donors, but to the change that they're hoping to see in their community. And just like Jasper said, even when we're picking the tool or a service provider is picking the tool, we're starting to set that agenda. And so working with them to think more towards their performance, their goals, their priorities will help them have better horizontal and downward accountability. But also the types of capacities that an organization may need to be accountable to their community will vary a lot, depending on their context, depending on the stakeholders you ask, like Jasper said, or even the day you ask them. So while there are some organizational and technical capacities that are frequently cited, there are also other learning and adapting capacities, networking and influencing capacities, resilience capacities, and how those look and what performance looks like in all those different capacity areas will depend on their context and the outcomes that they're trying to achieve. So the USAID is also trying to change our approach based on what works here. What I've noticed anecdotally since the launch of the LCS policy is this mindset shift about who decides on what capacities count. One of my colleagues in USAID Paraguay, Laura Alvarez, was chatting with me about this just in April. She was saying that when she talks to new local organizations about the types of capacities they want to strengthen, it sometimes takes about 3 to 4 conversations to get to the heart of the matter. Their first response is often, well, capacity is just something we receive. It's done to us. You tell us what you want us to do. How do we comply with what you want us to do? And they might say, oh, well, the World Bank wants us to do this. The last time we worked with USAID, they wanted us to do that. CDC wanted us to work on our HR policies, so more of that. But through the LCS policy and what USAID Paraguay is trying to do, we're trying to change those mindsets and are starting to have conversations that begin with 10 years after this activity, where do you hope your organization will be? What can we do together to help you get there today? And then really listening. So with that starting point, excuse me, you'll find that the focus of capacity strengthening activities is different. It's not just organizational or technical capacities in neat boxes. The conversation might go in the way of leadership development or founder transitions, like we were hearing earlier, or some and other capacities, right? Maybe the financial management or financial fundraising capacities that we also heard through the interviews. So these kinds of conversations can help us move away from capacity building done to local organizations towards capacity strengthening done with and for. These and other types of shifts local actors have asked us to make in our capacity strengthening activities and approaches can be found in a helpful Making the Shift tool that I'll also have Bronwyn link in the Q&A for you all if you're interested. And these came out of conversations from the Local Capacity Strengthening Learning and Feedback Forum from 2023.
Thanks, Sarah. I think that's a great segue as we start to talk a little bit about these assessments and tools that have been brought up. So as we mentioned earlier in the webinar, when Sarah Paddington was presenting, a key feature of NPI's approach was facilitating capacity assessments, meaning we didn't go in and do an assessment of the local organization, but rather we tried to put the local organization in the driver's seat to self-assess according to their organizational goals and prioritize the sort of support they needed to get there. But sometimes it is a big challenge for those entities providing capacity support to ensure local ownership of self-assessments and capacity strengthening plans. It is a fine line that the entity providing capacity technical assistance doesn't do too much or lead too much. Jasper, perhaps you could speak a bit on how you manage this challenge with NPI EXPAND.
Thanks, Erin. First, as I mentioned before, of course, we use the combination of several different tools. Our standard, combination of tools we are using to achieve, that holistic look of capacity was both the organizational capacity assessment combined with the technical aspects, so ATOCA for that matter. But we also introduced the OPI, Organizational Performance Index, so that then we are orienting organizations to start thinking beyond the output level into the outcome level. That's one thing that we did. We tried to adapt these tools to suit the context of NPI EXPAND. One thing I remember I told my colleagues at NPI EXPAND at the beginning was, if we had a way, we could customize these tools, adapt them to the specific context, even if it's at the organizational level. That way they'll be more adapted. Organizations will identify with them probably more, own them more, and probably it will influence, that agenda continue beyond the level of NPI EXPAND. So in terms of approach, we were very intentional in using a participatory approach in our capacity assessments, so that way we are giving the opportunity for the organization to lead this process of identifying the need and prioritizing the needs. We trained our staff internally to be able to do these assessments using the approach that we were advancing or we preferred within NPI EXPAND. And in those countries and situations where we used consultants, we also actually did deliberately train consultants, many of them, of course, used to using an approach where is an external party, completing the assessment, being adapted to oriented to using a more participatory approach, which takes time. It's a more process-oriented, it's more laborious, and for a consultant wants to complete their business very quickly and leave, but appreciating that there's value in creating environments where people discuss about those priorities as we move the process forward. So those are some of the innovations we did in NPI EXPAND.
Thanks, Jasper. So in a way, you've already started talking about adapting OCAs and TOCAs, but Sarah, given the thinking around capacity strengthening is evolving, do you have any additional thoughts on whether any adaptations may be necessary in the industry's overall capacity assessment approaches and tools, particularly as we turn towards using performance improvement to demonstrate that capacity was actually strengthened?
Yeah, thanks so much, Erin. And before I answer that question, I'm so excited that my colleague Laura Alvarez, who I just talked about in my previous question, is actually with us in the webinar today. So say hi to Laura. So so a quick question, and this is not a gotcha question, Jasper, but did the NPI EXPAND activity, do you know of, ever take your own adapted organizational capacity assessment or the OPI?
As a program, no, we did not.
Yeah, as a program, no. And probably Palladium didn't either. And USAID hasn't either, right? We haven't taken an OCA or an OPI. My office certainly hasn't. And the reason why you might say that, or I might say that, is that it's not designed for us. It's not our business model. Or we know what we need to focus on based on our strategic plan, pulse checks, financial reports, and other data points. And yet we apply this standard tool or many standard tools to many organizations around the world. So I love that the NPI EXPAND activity tried to adapt as much as possible to the context that you are working with your capacity assessment, because it's hard to do just one standard assessment for everyone. And I'm sure, though, that many of you will notice that the vast majority, of course not all, of the capacity assessments and action planning tools for local organizations have numbers and categories. And as we were talking earlier, by having those categories, it sets the agenda of what we're talking about. And then the difference between a score of 2.3 and 2.5 is discussed in depth. Meanwhile, if you see different kind of donor-focused self-assessments, for example, the OECD DAC criteria for donor agencies self-assessment and capacity development, it's a discussion guide with no scores. Now, I'm not saying that an OCA has never been useful, and I've heard some local organizations that have really appreciated it, who wanted to see all the different types of kind of internal capacities. But that's just the point. Some, not all. I'd also note that an OCA is not actually a capacity assessment. It's an action planning tool, kind of like you were talking about, Jasper. It's based on who's in the conversation at the time. It's not externally verifiable. And it doesn't really talk about performance. You can read more about the distinction between all these different types of tools and how best to apply them and when to use them in a guide to distinguishing tools that I've also asked Bronwyn to put in the Q&A as well. So the challenge with the OCA and some of the tools is really in their incorrect application. So tailored self-assessment tools can be extremely useful for capacity action planning, but the proof of change or performance is not in their scoring. It's in the organizational performance. So I expect, and I honestly hope, that we'll be spending less time, and local organizations will be spending less time on assessments for donors or designed by donors, and more time engaged in actually the work of change management, trust and relationship building, network strengthening, and capacity sharing. That the mindset of those providing capacity strengthening services will shift from the expert with the solution to that guide on the side providing support when requested, appreciating the existing histories, relationships, knowledge plans, capacities that exist at the local level. That's all.
Thanks, Sarah. Excellent. So we asked, shifting a little bit to more sustainability and how people have taken what NPI EXPAND, what they've learned or done through NPI EXPAND, and kept it going. We asked a few of our local partners how they're passing along any new skills or systems their staff a knowledge of systems that their staff acquired under NPI EXPAND to new employees. And here are a couple of responses.
After the capacity strengthening activities, internal training programs have been started at Amman. We are organizing regular workshops and training sessions where current employees who have benefited from the NPI EXPAND support are teaching these skills to the new staff members. Moreover, we have also introduced mentorship program where we have paired experienced employees with the new hires to focus on key areas like proposal writing, report development, result-based management, etc. We have also maintained detailed records of processes learned through NPI EXPAND, which new employees can easily refer to.
First, we have set up the training programs to a new employee. So whenever the new employee joins our team, we make sure that they're all trained. And this training we're designed to teach them on how to use our systems that were developed during the implementation of NPI EXPAND. So from day one, they feel confident to contribute to our mission. But second, we believe in the power of mentorship and peer learning. So our employees are encouraged to mentor our new staff. So this ensures the transfer of skills, the transfer of insight from them to new employees.
So we have put in place a mechanism where the new joiners can access all the material which we received under NPI EXPAND program in form of those training courses, the action plans which we developed. So these resources are available on our repository, and it is mandatory for the new joiners to access those materials. For instance, in grants department, every new joiner will have access to the training courses we received under Humentum, such as USAID proposal development, USAID rules and regulations, and these are very valuable resources. And there were a couple of other useful resources which were given to all the grantee organizations. So we have kept all these material and the courses available for the new joiners so that they can access and make benefit out of it.
Thank you so much to our colleagues in Pakistan and Tanzania from the Aman organization, Shadefa Plus, and HDF for their comments on this. Jasper, have you seen any other innovative approaches organizations are using to ensure that capacity strengthening is institutionalized and passed along?
Yeah, and thanks to our partners in Pakistan and Tanzania for sharing those good ideas on how you ensuring that capacities are sustained in the organization. Two other examples I've seen. First, of course, organizations are now, particularly those ones who benefited and participated in the virtual training that we partnered with Humentum to implement for NPI EXPAND grantees. They are converting their, training that are designed to be, offered through in-person attendance to virtual trainings that are self-paced that staff can access and take from time to time. So that combined to developing repositories is a very good strategy of ensuring that these skills are continue to be retained in the organization. The other one is organizations are now becoming more deliberate, more setting aside resources to be able to retain staff that they think are of value to the organization, so that as projects come to an end, the deliberate efforts to retain a few staff that they think can be of benefit to the organization. And many of these are those that have benefited from the various training that they have attended, not just from NPI EXPAND, but other sources.
Sarah, what about you? Would you like to comment on any innovative approaches you've seen?
I think these are all great examples that we're hearing from Jasper and our wonderful folks joining us on video. I think the only thing I would add to any of this conversation is that when any of the capacity strengthening that's being done is focused on organizational priorities and their goals, it's more likely to be retained, right? So it's not just for this activity, and that's when the activity ends. Who cares about that training, even if we require it? But if it's really linked to because our organization wants to be X, because our organization wants to achieve Y, and linked to those priorities and those goals that the organization really believes in, you'll see the sustainability of those practices passed on no matter who's in the organization, if it's truly linked to their long-term goals and their beliefs there. Of course, we've talked a little bit about leadership buy-in, which is super important, but not going beyond training, including that kind of peer learning and mentoring and acculturation as new staff join. But I think really linking to the organizational priorities, and that's why we're doing any of these things, is a key to maintaining some of that momentum around capacity strengthening.
Yeah, Erin,
I
I
think
want to
so.
also add that.
Yeah, go ahead.
Yeah, sorry. Yeah.
No, go ahead.
Yeah, one other observation I've seen is that a number of training that various organizations could want to create, curricula for or training materials for are already in existence in some repository out there. So one thing we've done is to assist organizations to be able to identify what resources are available that they can tap into, some of them at no cost, and so that if they're creating new materials, then they're creating materials that doesn't exist. In NPI EXPAND, actually, we are very deliberate. Most of the materials we used were from other sources, and we are acknowledging that we're using this resource to strengthen our own capacities. The project I work in for now here in Kenya, we are also using a similar approach where we are not recreating new materials, but we are first looking out there to see what's available before we, invest resources into creating others.
Yeah, those are excellent points. I think also, Sarah, you mentioned the words acculturation and mentorship, and I think that's also key because there's a lot of great resources out there, and we should all be availing ourselves of those. No sense, as we say, reinventing the wheel, right? But at the same time, each organization might use those resources differently, or they might apply uniquely to how they want to go about their business and such. And so I think also this mentoring of new staff and really inculcating how some of these more global tools or I don't want to call them generic, but tools written for a wider audience might be uniquely applicable to what that organization is seeking to do in their context. So great points. Excellent. So Sarah, back to you. Perhaps the biggest shift in the capacity strengthening community has had to make right now, recently, has been moving away from these process indicators as the measurement of success, like how many staff were trained or policies produced, and really focusing on program performance as the yardstick that we use to measure whether capacity was indeed strengthened. We're now 5 years in the release of USAID's indicator CBLD9. Do you have any lessons learned yet or advice for how to really measure if capacity is strengthened through program performance?
Yeah, thanks, Erin. And I'll caveat everything I said with Sarah Pennington's presentation on the challenges of linking capacity interventions to performance improvement remain. So all of those things are very, very true. So I'll talk about it, but in a more general sense. And we have seen, at least since the release of CBLD9 5 years ago, that our USAID missions around the world are also starting to make this shift and understanding the use of this indicator to demonstrate the link between capacity strengthening activities and improved performance. So I think that's one of my first lessons, is that when this first came out, we were looking at the data and it was a lot of like, yes, policies updated. But now as we look at the data, missions are really starting to understand this and becoming creative. But as you all know, it's not your typical USAID indicator. It's a choose your own adventure style indicator. And that's why I think is pretty latest and greatest in general about CBLD9, the indicator. The localizations we work with, like I said, are getting creative and even more accurate in articulating their performance goals and linking those to measurable descriptions of performance. For example, we're working with an organization in Central Asia that is kind of independent media covering social political topics, and they have a YouTube channel. They wanted to improve the channel's monetization and sustainability. They worked on increasing the production and quality and number of videos produced, and by the end, they had 5 times the number of subscribers and increased their annual revenue by 36%. So those capacity strengthening interventions had to do with the number of videos, the quality of videos, and the production, but we didn't just count the number of videos. They counted how their annual revenue had changed. That was the outcome that they were looking for. But like you inferred in your question, capacity strengthening takes time. As one of my wise colleagues, Cynthia Fuentes in the USAID Guatemala mission, likes to say about the indicator CBLD9, if you see results immediately, you're probably doing it wrong. This perceived lack of progress on performance can sometimes prevent our USAID missions from wanting to report on CBLD9 in the first place. And that's why just 2 years ago, USAID added the optional CBLD 11 indicator, which Leslie just referred to in the Q&A, to capture the capacity strengthening efforts made towards performance goals. Essentially, it's the denominator of CBLD 9, but it's there to help us capture and appreciate more of the in-progress capacity strengthening work, while still indicating that performance is the goal.
Thanks, Sarah. So Jasper, I'll give you a chance to comment on what are we measuring, how are we measuring it, and how do we reconcile these issues of capacity strengthening often being short-term investments, improving performance might take a long time. And then we also have this complexity of all existing in a certain context where there might be external factors that are influencing whether performance is improved or not, like weather events and political instability. So Jasper, what are your thoughts on this?
Yeah, I'm one person who was actually very happy when I saw USAID issue the CBLD 11 indicator that will be implemented, in combination with the CBLD 9, because we are feeling very frustrated, being required to report on the CBLD 9, yet we, in the back of our minds, we know this will take time, and probably for a specific USAID program, you'll not be able to see and report results immediately. So you're already uncomfortable reporting zero progress on CBLD 9, yet you've done and invested a lot of resources on capacity strengthening for these organizations. So the combination of those two indicators, in my opinion, is a very good innovation. We probably need to go a step further now that we have probably there'll be second or third year. Sarah, you can confirm that, reporting on the combination of the two indicators, providing more guidance on now the interplay between the two, so that organizations, development actors can maximize on use of those indicators. The third indicator, I think, will also be very critical to focus on for us as development practitioners is the CBLD 10, because it's all about domestic resource mobilization. And this indicator, for me, is like the highest level of demonstration of commitment to the cause of the organization, be it capacity strengthening or end development effort they are doing. The moment local resources are being mobilized to support those efforts, that's the highest demonstration of commitment in capacity strengthening. So what I'm doing right now, and I'm applying some of the lessons I learned from NPI EXPAND, is support the local organizations we support in my current project to identify capacity strengthening indicators that can enable us to report on the CBLD 9. And we are using a combination of both output and outcome level indicators that are aligned to the domains of the OPI. So we are using the OPI as the framework, but not the OPI, using the scoring of the OPI as we applied previously, but those domains to be able to define these indicators. One organization actually has been more innovative, and what they have decided to do is use their strategic plan. I've identified 2-3 indicators from their strategic plans that are aligned to the project that we are supporting them to implement. And reporting on those indicators will enable them to report on the CBLD 9, and also they're reporting internal on how they're progressing in implementing respective strategic plans. I see such an organization being motivated to continue, using that methodology to report their progress, even beyond the level of the project you're implementing. Thank you.
Excellent. Thank you very much, Jasper. All right. So my last question for today. We asked a few of our local partners if they were designing the next USAID capacity strengthening project, what would they like to see included? So let's hear from Imane in Mali and HDF in Pakistan.
Bonjour, je suis Dr. Moulay Berthier, chargé de suivi et évaluation à l'ONG Yamada. Je vais répondre à la question 7. Si je pensais vers les prochains projets de renforcement des capacités de l'USAID, j'insisterai sur une approche plus centrée sur la durabilité et l'autonomisation des organisations locales. Je souhaiterais voir des formations plus approfondies sur la gestion financière et l'autofinancement, ainsi que sur l'utilisation des technologies numériques pour maximiser l'impact des projets. De plus, l'accent devrait être mis sur un accompagnement de long terme, même après la fin du projet, pour garantir que les compétences acquises soient véritablement intégrées dans la structure organisationnelle. Merci pour votre attention.
So if I were to design the next USAID capacity strengthening intervention, I would basically include the components such as how to negotiate indirect cost rate, and how to work directly with USAID, and how to prime the awards, and what does it take to prime the awards with USAID. And I would basically equip the local organizations with such courses which would strengthen their teams and their management to improve their internal systems and align them with the requirement of priming the awards with USAID.
Thank you so much for those comments. They're excellent. So Jasper, now's your chance. What would be one of your priorities for the next USAID capacity strengthening project?
I think for me, and probably this is already happening, supporting local organizations to, build a reserve fund that can enable them to, for instance, retain those critical staff we talked about during the dry period, between projects. That would be a very good, addition to the design process of new projects. And probably it is already happening with the increase of the de minimis rate from 10 to 15%. Probably there are other innovations that can be done along that line. I was very happy to hear Sarah's observation that we can implement capacity assessments to set a capacity strengthening agenda without thinking about scoring an organization. I have implemented capacity assessments without a score. I like the way the discussions evolve. I like the commitment and how genuine people are in identifying the needs when we don't tie that to, because of this shortcoming, you are at this level, you are that level, so that people are then more transfixed into the scores than the substance of what they need to address. Those are the two thoughts I can share.
Thanks. Yes, I've often seen people debate over a 2.3, 2.5, and that takes away, I think, from the larger conversation. Sarah, as our esteemed colleague working at USAID, what would you like to either see continue or done differently in the next iteration of this global project?
Yeah, I'm manifesting these things into the world. I would like to see more time spent on strengthening networks and trust and collaboration, and really emphasizing that instead of competition over resources. And I honestly think that's going to be linked to financial sustainability as well, to resilience of organizations, to maintaining capacity when USAID isn't there, and maintaining the progress being made. And I'd also like to see the success or the efforts of that network strengthening measured too. And how is that, or is it driving improved performance and better outcomes? I think our network strengthening and our relationship strengthening now at USAID is a little bit like as possible, ad hoc, as we have time, but being more intentional about that and seeing if our efforts are having an impact on outcomes would be something I'd really like to see investment in. I'd also like to see in all activities more accountability and feedback between the capacity strengthening service providers and receivers. I think NPI EXPAND tried hard to do this. And I think that doing that shifts power dynamics. And so instead of asking local actors, did you like this training? Yes or no? Is this helping you achieve your performance goals? And how could it be better? And having the capacity strengthening service providers reporting on that, the effectiveness, the outcomes of their trainings instead of number of trainings or that difference between a 2.3 or 2.5. I do hope we'll get to the Q&A because I see a great one from Patricia Garcia, who I used to work with at Training Resources Group, about how shifting that mindset between a 3 and a 4 or a 2.3 and a 2.5 is a challenge for some USAID colleagues.
Yeah. Well, maybe we have several questions. Let's start with that one since you've noted it. So the question is, you mentioned that one challenge with organizational capacity assessments is the focus on numbers rather than managing change, sharing experiences and other factors. I've seen this too. However, both local and international partners often want to see numeric processes like we are a three, we were a 3, now we're a 4. How can we shift this mindset? Do you have examples of different, more effective approaches?
Well, I'm not going to have the total answer, right? Because when we talk about shifting mindsets, based on the individual, their incentives, their backgrounds, their iceberg of beliefs, right? But I do think something that we're trying to do in our communications at USAID, especially when we're working with our missions, is using CBLD 11 to complement CBLD 9. So we're still acknowledging the efforts that are being made, that you can say, yes, we have made efforts towards performance improvement, even if you're uncomfortable reporting 0 on CBLD 9 towards performance improved. So recognizing that a little bit more. I also think linking capacity strengthening to the performance and not towards the outputs is something that we're really emphasizing. So we're capacity strengthening in and of itself is valuable. And I think some sectors like the DRG Bureau really care about that because they see it as a longer term systems investment. But it's a much more effective conversation for much of our technical work to say, well, we're not doing capacity strengthening just because it's nice. We care, it is nice, and it is good, and it does create a stronger system, but also because it produces better results. So really tying the difference between a 3 and 4 doesn't really matter. What is the result? How many CYPs are increased? How effective was your influencing of policies and laws for better environmental protection? So linking capacity strengthening to those outcomes, not just the shift in a score that is often not externally verifiable. So I think those are kind of our approaches, but it often ends up being mission by mission. And thankfully, I'm super lucky to be on the New Partnerships Initiative team. I'm part of the local Faith and Transformative Partnerships Hub, where we do lots and lots of direct mission technical support and assistance. 3 of my colleagues are currently on TDY. I'll be heading to Jordan pretty soon. We spent a lot of time with our missions, really thinking through this. What does this look like? What does it mean for you in your activity, in your programming, in your mission, in your context? So yes, there's some broad communication about that, but there's also a lot of specific hand-in-hand conversations. I'm not sure if that actually answers it. And I would love to hear from Jasper.
Yeah.
You have
Jasper,
answered this question in the
Okay,
comments.
2 observations. Yeah, I think there's a lot we need to do even among the past development practitioners on changing the mindset about capacity assessments. Many of the tools and approaches I see out here have the score integrated into them. And the organizations are so passionate about this tool, are so passionate about this approach, and dissuading them to think, implementing these assessments without thinking the score, I think is a big, big task. If all of us as a capacity development community can get into consensus that this is the new way that we can implement capacity, set the agenda for capacity strengthening, scoreless, let's have a discussion, let's identify priorities, let's focus on what's practicable over a short period of time, the time period for the project. Probably that would be a major, major contribution. Now, one observation I've made, and this is my second point, in situations where we are combining capacity strengthening with award mechanisms, and in particular, the fixed amount awards. And we are using, deliverables from those capacity strengthening efforts, maybe policies developed, etc., for the organizations to report on the milestones, progress, and receive their payments over the period of the grant. There's a shift in focus from capacity strengthening, developing policies to strengthen the organizational systems to make them more efficient, into ticking the milestone boxes. So we need to be very careful when we are combining, the various pieces of our development work, particular grants and capacity strengthening efforts, so that we don't lose the focus.
Thank you,
That's
Jasper.
a great point, Jasper. Can I jump in? Sorry. I think the use of fixed amount awards in capacity strengthening is so interesting. It's been so valuable for many places. But like you said, Jasper, you have to pay attention to the incentives, right? It's not, capacity strengthening is rarely done, completed, but you need to be able to prove that you've achieved something in a fixed amount award. to be able to receive the resources. So figuring out what those incentives are, but not over incentivizing the check the box activity there is really interesting. And then I wanted to emphasize another piece there is that I think the positive youth development approaches have been really successful in doing this for some time. So taking that appreciative approach, not scoring based on numbers, but really having a conversation. What assets are we bringing to the table? How do we want to continue moving those forward? I think learning from kind of that body of work is really helpful. And yeah, I've seen many organizations have really valuable conversations around things like the SOAR self-assessment, so the strengths, opportunities, assets, and results versus like a framework versus like a tool like the organizational capacity assessment. But I love your comment about fixed amount awards. I'm gonna find hopefully and drop a white paper in the chat about that.
Thanks. Okay. This is an interesting question from the audience. You've had insights about supporting organizations that are looking to strengthen their systems for future growth without presently having internal capacity to put new systems into practice. Sorry, that's a question like, do you have any insights on this? So, for example, setting up financial management systems that can manage large awards in the future, but without any finance expert staff in the present. So this is great. This is from an ambitious organization or a person thinking about ambition with organizations who might be on the smaller side, but want to be a prime or be a larger organization. So how do you sort of, this is very much like about that vision of the future and what they're going to need to be that vision of the future that they want to be, but they're quite small at the moment or fragile in some aspects. So what are your thoughts on how best to support an organization like that? I'll send that to Jasper first.
Yeah, thanks, Erin. A tough question, but this is my take. I think it's good to be realistic with an organization and its absorption capacity, so that the capacity of its absorption, and you can very easily be able to determine this by looking at what are their budgets, of course, in a physical year, so that then you have expert advice on what system can the organization integrate in its operations to be able to support its level of, physical capacity, absorptive capacity. So that way, then you are not overwhelming them. And I'll align this with the principle of do no harm. You can introduce such a complicated system to an organization, and as opposed to supporting this organization to shine, you're actually overwhelming them, and people will be discouraged into focusing on improving their internal systems. So getting expert advice, being realistic on what really you can be able to absorb, I think that's a very, very good a very key consideration.
Yes, excellent point. Managing growth is a skill in and of itself, right? And that's an important thing to keep in mind. Sarah, do you have any thoughts on this one?
Not much more than what Jasper said, but I appreciate this question from Zach and his engagement in the local capacity strengthening forum over the past couple of weeks. I think ultimately, I'm always about trusting local organizations, right? So if an organization says they want something, then like I can, or we can, or a service provider can be a helpful guide on the side, provide expert expert consultation, be a resource, and but as called upon. Ultimately, local organizations have a vision in mind and know what they need, and we should trust them to make those decisions. I do agree that it's helpful to have that relationship where you're not setting unrealistic expectations, right? Like, now that you've had this training, you will now get an award, right? Like, that's not how it works. But helping them achieve their future vision can be helpful. And I know this takes it a little bit on a side path, but this is what I thought of when I first read this question was, that's why cost recovery and full cost recovery is so important. And Jasper mentioned this earlier, the increase of the de minimis to from 10% to 15%, but there's lots of different pathways for full cost recovery for any of our partners, and that is USAID policy to provide full cost recovery for all organizations we work with, including local organizations. And so I think when we're providing full cost recovery, that includes being able to pay for the staff, the administrative staff that you need to run your organization for this activity, but some of the ones that aren't directly billable as well. So I think that this question kind of relates to that as well. Yes, supporting organizations to achieve their longer term goals. Yes, being a guide on the side who is trusted and has a relationship, but also making sure that organizations are recovering their full costs so that they're able to pay for the teams and the resources and the people and the systems they need to do their work effectively.
Great, thanks. All right, with only 5 more minutes left, I have one final question. This is an interesting one. I'm not sure there's a right answer, but we all agree, I think we all agree, that demand-driven needs identification is essential, that this should be our priority. And this approach relies entirely on the local organization who may not always know what they don't know. I mean, I don't know what I don't know as well. So sometimes we need help with that, especially in technical areas. So what's the appropriate way of using technical expertise in such a situation? Jasper, I'll turn to you quickly.
Yeah, I've been in situations where you find organizations prioritizing certain things from a point of lack of knowledge, lack of information on what is out there, what is the best practice. So for me, if you as a facilitator identifies such a situation, I think the beginning point would be to educate first so that you bring them to a level where they can be able to see the world in a more open, in a more wider perspective than what the situation is at that moment. Then based on that, you then begin exposing them what other things do they need to start thinking about beyond what they proposed. Yeah, so it's a bit of a process. It probably take longer time to identify and prioritize some of these needs than you could have wished, but probably something very important to consider so that then you widen the perspectives and options that organizations need to pick from.
Thanks, Jasper. Sarah?
I'll just add, I think this question has a lot to do with power dynamics, right? So is USAID in the room? Who is the donor in the room? Are they in the room? Who is the expert facilitator? Is there a relationship of trust and openness there to have a meaningful conversation? Kind of like I referenced earlier with our conversation with Laura, she had to have 3 or 4 of those conversations until getting to the real long-term vision of the organization, not saying what they think they should say or what they've had to say before with other donors. So ultimately, trusting local organizations that they do know what's going on, but then also and what they want and what they need, and then having important, valuable, trust-based relationships over the long term to ensure that any of our direction or our influence is really helping in context specific and not guiding entirely, right? Just on the side and supporting. I will say we all don't know what we don't know. So we always need those supportive friends. I think USAID as well, definitely, maybe even more so. And so I think that's what's valuable about the 7th principle of the LCS policy focused on mutuality. This isn't capacity to or capacity on local organizations. This is capacity with, this is capacity sharing, right? So in those trust-based conversations, sure, we might be advising or educating an organization about the potentials and opportunities, but we're also learning from them as well. So working on our relationships and our trust to have more of that mutual capacity sharing.
Excellent final point. Thank you so much, Sarah. So with that, we have come to the end of our time today. First, I'd like to thank everyone for your participation and extend our gratitude to the panelists for such a rich discussion. I would also like to say thanks to our local partners who sent in their thoughts via video clips. We really appreciate your contributions and we're pleased to hear your perspectives. Finally, I would like to thank Bronwyn Warnick and Stephanie Mork who helped us pull together this webinar. Today's event is the last of a series of 8 learning events from NPI EXPAND. Remember that the recording of today's event will be posted on the NPI EXPAND website, and don't forget to check the NPI EXPAND website and social media pages for more about the project and our resources. Thank you again to everyone, and have a great rest of your day.
Thank you so much for having me, Jasper. It's always such a pleasure to listen and learn from you.
Pleasure having this opportunity to share experiences. Thanks everyone.
Thank you all.
Stop. Bonjour, je suis Madame Dolo Oumou-Djombele, directrice exécutive de l'ONG Yamane Mali. Je vais répondre à la question numéro 1. L'intervention de renforcement des capacités la plus précieuse que Yamane Mali a reçue de NPI EXPAND est l'apprentissage en faisant, le learning by doing. Cette approche a permis à Yamane d'avoir des outils de gestion comme le plan stratégique 2024-2028, le plan de mobilisation des ressources et des outils numériques pour le suivi et évaluation. Donc, tout cela a contribué à améliorer nos performances de nos projets sur le terrain.
Bonjour, je me nomme Cheikh Oumar Kida, point focal genre à l'ONG Yamane Mali. Et je vais répondre à la question numéro 2. Pour pérenniser les gains réalisés grâce à NPI EXPAND, nous intégrons les compétences acquises dans nos pratiques quotidiennes et dans nos plans de développement à long terme. Nous avons également formé nos équipes à appliquer de manière autonome les outils et stratégies introduits. Même après la fin du projet, les plans stratégiques élaborés avec NPI EXPAND continueront de guider nos actions, en particulier dans le domaine de la gestion de projets et de suivi et évaluation. Cela nous permettra de rester résilients et d'améliorer nos performances à long terme. Merci de votre aimable attention.
Following up the grant support received from NPI EXPAND, which ended June 2023, SHDEFA have been able to sustain the systems installed by using its internal source of fund, which includes the 10% de minimis, which is charged from each grant received, together with internal income generating activities. And up to now, all the systems are running, and we have been able to incorporate other features which will support the organization to manage its fund together with supporting other project management activities.
Capacity building, Aman has developed stronger skills developing high-quality project proposals, leading to an increase in successful funding applications for health initiatives. Reporting has become more structured, which help in better tracking of intervention outcomes and program progress. And staff empowered through training in program management have shown increased efficiency in implementing interventions. Teams are better equipped to handle logistical challenges, outreach efforts, and partnerships.
Je m'appelle Dr Cheikh Sarah, je suis le directeur exécutif de ADEMAS, Agence pour le développement du marketing social. Nous avons reçu un renforcement de capacité dans plusieurs domaines par NPA. Je peux dire que nous avons enregistré un succès dans le domaine de la communication pour le changement de comportement, puisque nous avons mis en œuvre une campagne dans une localité bien précise et montré des résultats très positifs quant à donc le changement du niveau d'indicateur, ce qui n'a pas été par exemple le cas en marketing et en mobilisation des ressources.
My name is Philip Wawerumbogwa, the Executive Director, National Organization of Peer Educators, or NOPE. NOPE is a local Kenyan organization that is in its 24th year since inception. NOPE has played a leading role in the implementation of health and social programs. These include HIV and AIDS, malaria, TB, family planning, sexual reproductive health, maternal, newborn and child health, among others. NOPE believes that every donor-funded project should have a capacity strengthening component. This means that in addition to funding for program activities, there ought to be a deliberate effort to strengthen organizational systems. Here we are talking about policies and structures for enhanced impact and sustainability. This includes governance and leadership, human resource management, financial management, and project management and planning. Through NPI EXPAND, NOPE managed to reach over 40,000 people in Narok County with family planning, maternal and child health information and services. NOPE worked closely with the county government of Narok in strengthening health systems, and the purpose was to ensure that our core beneficiaries, who are pregnant women, mothers and children, accessed quality health services. NOPE has faced several challenges in its capacity strengthening journey. One of them is that many donors fund us for program activities but disregard the need for capacity strengthening. NPI EXPAND, however, proved that this can be done differently. NPI EXPAND came to NOPE and in a very friendly way and facilitative way rather than commanding way, used well-researched tools, helped the NOPE team to assess the capacity gaps. We then prioritized these capacity gaps, and then NPI EXPAND provided us with the resources to address the gaps. This enabled us to update our policies, develop a new strategic plan and resource mobilization plan. We conducted board training and improved on our ICT infrastructure. The lesson here is that organizational capacity does not just happen. There must be a deliberate and targeted effort supported by resources. The second challenge is that capacity strengthening initiatives have not been accompanied by follow-up actions and concrete measures to ensure that NOPE and other local organizations actually access the funding. And we are talking about direct USG funding. The third challenge is localization and the way this is being rolled out. NOPE and other truly local organizations are finding themselves competing in an uneven playing field. We are forced to compete with international NGOs that have created local versions of themselves to meet the USAID definition of local. However, they are better endowed with resources and have a higher capacity, particularly in resource mobilization. We are therefore kindly appealing to USAID, CDC, and other agencies to consider streamlining localization. And this can be done through categorization of prime recipients according to capacity levels. There is also need to open up the space so that we have more local primes receiving direct funding. Our final challenge is unfair or imbalanced funding practices by some of the prime partners. For instance, NOPE has significant funding for program activities, but very little for its headquarters. There is limited funding for administrative expenses or the shared staff who have to work for different programs. Very few local organizations have a NICRA, and at the same time, very few understand the process of computing and negotiating for a NICRA. But even before we talk about NICRA, US government has been very kind to allow for a 10 to 15% de minimis. But NOPE's experience is that many of the prime partners do not allow for indirect costs. So many local organizations are forced to live from hand to mouth. In conclusion, NOPE is grateful for the localization agenda. We see this as a positive move that will enable local organizations to become more effective and sustainable. It only requires a few adjustments so that no organization is left behind. Thank you.
If I was in charge of the USAID funded capacity building project, what I would do different from the approach considered previously would that be that I would divide the trainings into different phases. One will be the pre-training, that will be the work-based, and it will be some assignments will be given to the employee or the staff or participants who has been selected for the training, which will be followed by an in-person training, and then a post-training assignment, which that will also be work-based assignment, which will be given to the person. In this way, we can sustain the results and the outcomes of the training. Apart from that, apart from the training, we can also give some resources to the national and the local organizations, because it is one of their challenge that they want to incorporate certain things which we have learned from the trainings, but they need resources. For example, if we have received training in the management information system, but we don't have the financial resources for the management information system, then how can it be incorporated? So this will be my second consideration.
Je m'appelle Dr Jasper Ondieki, je suis le directeur de ADEMAS, Agence pour le développement du marketing social au Sénégal. Pour le renforcement des capacités des organisations locales, il faudrait que l'USAID et les autres partenaires au niveau mondial fassent d'abord l'évaluation des besoins, mais également la priorisation des interventions de renforcement de capacité. En commençant par le renforcement institutionnel, pour pallier, n'est-ce pas, à la précarité de ces organisations. Il faut qu'on renforce les piliers de développement institutionnel pour aller vers la pérennisation. Je veux parler de la bonne gouvernance, de la capacité de gestion administrative et financière, mais également toutes les capacités techniques que l'organisation doit avoir pour assurer sa pérennité.